Go live. Source of that radiate, more in a power cold night, support and comfort, support and comfort. Ask is floating down the mountain, calling the children of earth with love in their hearts, with love in their hearts. My soul never loses hope, because your love always takes me. The solution lies in our home. The solution lies in our home. Oh, my mother said, Verena, harvest of wonderful blessings. Make us more son of creation. Make us more son of good creation. Oh, Jesus, here I am, my knees on the floor. You say thank you, my Lord, for the light that comes through this door. Your love is the key to change the entire world. Using these chains wisely, we will live in peace and harmony. Now I understand. He's helping myself. Your words now are so crystal clear. Your teachings have no frontiers. To see all this transformation, we just have to put love in action. Blue crystal eyes, colors of the sky, gray bushy beard, sometimes look alike. Shine on your brothers on earth, suffering, living joy, or in pain. Blue crystal eyes, colors of the sky, gray bushy beard, sometimes look alike. Shine on your brothers on earth, suffering, living joy, or in pain. Say achievement Apostle of the good, receive our prayers and also our heart. Blessed Archiemenesis, Apostle of the light, place our pain at the feet of Jesus Christ.
Wherever you are, glowing seeds of love, as our Master Jesus taught. You will see that behind every sight there's a flame shining bright, tiny spark created by God. I will follow your path, Father, 'cause nobody's alone in life, and the scars of my destiny will be healed by your love. Disseminate wherever you are, glowing seeds of love, as our Master Jesus taught. As our Master Jesus taught.
Hello, everyone. Good evening. We welcome to our public meeting, and we thank everyone for joining us tonight. Before we start, we would like to share a couple of announcements. We ask you to turn off your phone notifications and find a quiet place to stay during this time if possible. Our meeting will have 30 minutes presentation followed by Q&A. And following the presentation, we will have a spiritual treatment with passes and magnetized water. So we invite you to set aside a container with water to be magnetized. And We have a special invitation for who wants to learn more about Spiritism. Every Saturday at 5:15 p.m. East, we have an online and free class on our course Get to Know to Spiritism. The theme of this Saturday's meeting will be mediumship. What an amazing topic, right? So if you are interested, join us to join us, and the registration link will be posted in the chat. We also invite you to follow us on Instagram, Facebook, and YouTube from the Spiritism Canada and the Spiritism Group Path of Life. So now I invite everyone to join me with our opening prayer. Let's close our eyes if you wish. Elevate our thoughts. Think in God, in Jesus Christ, and thank you, God and Lord, for the opportunity to be here one more Tuesday to learn more about your doctrine, about your teachings. We thank you for everything you have done for us, for your mercy, your love, your protection. We would like to ask your protection and your inspiration for the speaker tonight, the tonight's speaker. And may everyone can learn a lot from him. We ask your protection for this meeting, for everyone who is working to propagate the Spiritism in Canada. And we ask the good spirits to stay with us today and always. So be it. The topic of today's meeting, today's special meeting, is Spiritism and Medicine, a new paradigm for the millennium. And it will be facilitated by our brother Dr. Sérgio Thyssen from Brazil. We also would like to announce that our public meeting is being retransmitted today by Continental Conference America through their Facebook, and will also be retransmitted every Wednesday at 8 p.m. by Kardec Radio through their Facebook. And everyone is welcome to write comments and questions in the chat, and we will address the comments and questions at the end of the talk. And now we invite our tonight's speaker, Dr. Sérgio. Welcome. Hi.
Hello, Marcel. Thank you for your invitation. I am very happy to stay with you and with everyone in this little meeting about bridging spirituality and medicine.
Okay, we are very happy to have you here. So now it's all you.
Thank you so much. Thank you. Well, I'd like to remember that we are living some kind of new age because our world, we are changing in many ways so much because of the development in terms of understanding and comprehension about our condition and reality in terms of human beings on earth. I would like to tell you that I am a physician. During many decades, I am a cardiologist, internal medicine practitioner, professor of medicine. And I was a son of my father and mother because they are spiritists, and so many. I have many different instruction in terms of spirituality, gospel, and many things related of spirituality. But I am working, I am doing some kind of work in the frontier, in this frontier between spirituality and medicine. I would like to remember you that we have in our humanity more or less 20 billions of souls, and we have many different moral deficiencies, and we are here in the spiritual point of view to have and to do together some kind of re-education and regeneration according to the moral and ethical codes of the universe. I'd like to remember that we have something like that 8 billions of people in this side of world. And so by one reference by Emmanuel in just a specific book, one mediumistic book, 12 billions of discarnated people in the spiritual world. So we learn about the integration and the relationship between these two different worlds. So in this is, history of humanity, we have more or less, in terms of writing history of humankind, we have the same time from 5,000 years, the history of medicine too. And we live in those years one kind of model in medicine, one kind of paradigm, because only in those recent decades that we are knowing about our true conditions in terms of human beings. And we do not have only physical bodies, as many colleagues of mine just now they think about the reality. And because of Allan Kardec and Spiritism, we know, and because of many others authors, we know that we have our souls or our spirits. We have some kind of spiritual body too. And all this is important in this new understanding of the medical problems that you have. I don't know if you know about this, but we have thousands of different diagnoses in medicine in terms of clinical diseases and mental problems in the psychiatry area. And we are dealing with all of this spectrum of possibilities to work in this frontier, trying to do something like that, a bridging in spirituality and medicine. I would like to tell you one idea that it is the idea that the earth, this is one big world with 20 billions of human beings in the two different possibilities to live, spiritual and physical existences. But we have one understanding that this is a hospital. The people, the spirits that live here in those millions and millions of years, we have big moral problems. And we are here because we need to enlighten. We need to live some different situations during the common life to obtain this kind of enlightenment to a different lives in the future, because we suffer, because we have many diseases, and because we have many different troubles in many and many countries uh, uh, in the world context of life. I would like to tell to you that because of the Spiritism and because of some kind of uh, interest to study mediumship and to do one kind of work utilizing mediumship to care our patients. I receive many different cases during those recent decades of activity in this frontier between spirituality and health. I'd like to point one aspect before. We understand spirituality because spirituality is different of spiritism. Spirituality, it's a set of moral, mental, and emotional values that guide the thoughts, behaviors, and attitudes in the circumstances of intra and interpersonal relationships. We have some other different definitions of spirituality, but I prefer this one. And Spiritism, it's another thing, uh, because we have different concepts, different studies, and understandings about life. And now we are going to a new model in terms of medicine, because during all that millenniums on Earth, during the development of the science named medicine, we are now obtaining some kind of understanding about life, reality, and different possibilities to use spirituality to care our patients, but not only to care, to understand the suffering, the signs and symptoms of those different diagnoses in medicine. And we are working in this frontier during many decades. And I would like to tell you one very interesting aspect in this meeting, in this issue that we are dealing today. If I enter the NIH, National Institute of Health in the United States of America, this is the best site to do some kind of research about everything in medicine in those days. So when I enter the PubMed, this is one space in the NIH, because if I would like to know about one respective issue in terms of the medical science, if today, as I did this morning, I enter again, and when I put the term of the word spirituality. This is one side of medical science. I know that we have many medicines. We have one, uh, the idea of the medicine when we talk about this is the scientific medicine, but we have one different medicine in homeopathy. In China, the traditional medicine in China, the Ayurvedic medicine in India. So we have different medicines. But when I understand medicine, this is the common understanding that we have around the world. When I enter this side, and when I put the word spirituality, I have 24,000 of papers with scientific methodology to study spirituality in medicine. So I have the contribution of many different hospitals, clinics, and universities and faculties of medicine from all the countries around the world, doing some kind of research with scientific methodology to learn about. If I put the two words to close my research in that site, spirituality and health, I have 16,000 of papers from different groups of research around the world. If I put one very beautiful and important aspect in this frontier between spirituality and health, if I put the word prayer, look this, prayer only, I have 75,000 of papers in medicine. If I put, for example, gratitude, I have 2,000 of papers. Gratitude. This is a new medicine in a scientific approach. If I put the term of word meditation, I have 88,000 of papers. If I put mindfulness meditation, I have near 3,000 of papers. If I put the word compassion, this is very beautiful. Compassion in medicine, 34,000 of papers. Empathy, 30,000 of papers. Charity, 12,000 of papers. Forgiveness, near 2,000. Spiritism, not only and not as I put first, spirituality. No, spiritism related to spirits and Allan Kardec, I have near 12,000 of papers. If I put the words religiosity, I have 4,000 of papers. If I put religion, 74,000 of papers, and concluding this research from myself, Jesus Christ, I have near 300 of papers. I would like to tell you about this because this is a clear idea of the changing of paradigm in medicine. I can tell to you that if my colleague or my colleagues in general in any country in the world that do not study about this frontier, do not tell about the spirituality, religiosity with their patients, they are out of one idea of the best understanding and actualization about medicine. For example, if I analyze the humanity in terms of numbers, 82% of the people in this humanity, obviously, they are linked with some kind of religion, religiosity, spirituality, understanding about life. And this is one evidence that invite us to share with our patients about this kind of issues and understanding about illnesses and recovery processes, including drugs, medicines, procedures, surgeries, and many other possible approaches in medicine. And so I would like to share this information with you because we are living independently of many big problems in this humanity, as we have today in Ukraine, for example, in Syria, Yemen, Afghanistan, many different countries in Africa. But independently of this big suffering process, because of bad moral aspects in this world, we have some very nice aspects to invite us to study spirituality. I would like to share with you some kind of personal experience because I know about Spiritism. I study Spiritism from my adolescence. Very soon in my life, I had the interest to understand how to be in the communication with the spirits. And during the last 4 decades, I am working with the spirits. I am working in the Spiritist Society 2 times a week during all these years to use the good spirits to help us in the caring of the patients. But not only this, we understand that the medical problems, the chronic or recent acute medical problems in mental diseases, and so in surgical and clinical and intensive medicine, intensive care medicine diseases, the presence and the very important presence of discarnated spirits, discarnated people linked with the diseases and the patients that we are trying to care. This is completely new in terms of the history of medicine, but not only, but this is very recent approach in terms of modern medicine. But not only, we have the idea that one aspect is spirituality. Because this term, this word, have many very broad understanding in terms of many different cultures of the people around the world. But Spiritism and medicine, this is a more specific aspect of that frontier, general frontier between spirituality and medicine. And I am working here, understanding the abroad aspect, but carrying the patients that we receive in the Spirit Center by some kind of open doors to the people and the family of those patients that are looking for some different approach to help them because they are tired. They are understanding that only the medicines and common medical approach, for example, in terms of cancer, cardiovascular disease, different infectious disease, as we have in all our humanity, we do not have many opportunities to obtain one high level of recovery in terms of signs and symptoms and in terms of cure. So they come to the Spirit Society asking for our groups to have some kind of benefit. So during that decades, we are dealing with, for example, when I receive a patient with depression, and because of 3 attempts of suicide, because of depression, we know that we need to respect and use the antidepressive medications to care that patients. But if I only use the antidepressive medications, that patient will be during all the future life needing to use those medications, because when we interrupt the use of those drugs, all the clinical presentations comes back. So now we understand that when we have a cardiovascular problem or a neurologic problem, including Alzheimer's disease or dementia, tuberculosis, malaria, pneumonia, patients with 19 COVID in the intensive care unit, fighting to stay alive. When I have a breast cancer or a prostate cancer or a lung or a gastric cancer, all those patients, they have spiritual context, because when we enter that cases with the group of mediums, we can detect the past lives immediately, and facts related in that past lives with the suffering of each one patient they have now. And we find many spirits, as we are spirits too, obviously, but discarnated ones, related to the diagnosis and the grade of severity of each one patient with the same diagnosis. And when we care of them in terms of fraternal dialogue, the passes, the magnetism, when we use all the experience with love, fraternity, to help those spirits that we find in a big suffering in the spiritual realm, it is very nice and it's very clear. We can see in the next days, weeks, or month, one different prognosis, one different kind of recovery. And because of this difference between before and after, this approach, this mediumistic approach, I am doing this kind of research to put in evidence some kind of materialization of the evidences of the spiritual causes of the majority of the diseases in the conventional medicine. And then we compare, for example, I have many children and adolescents with autism spectrum disorder. We have so many patients with depressive disease, others with anxiety, with drug abuse, schizophrenia. And then we do the same. Mediumistic meeting, and then the fluid therapy, the magnetized water, and the hands in position, trying to change, including not only perispiritual context, but material, physical body context, cells, changing the pattern of the tissues modified because of different diseases. We are trying to help, and we are dealing with the good spirits because they do the more important aspect of this kind of work between spirituality and medicine. And I would like to remember you that because of this opening process in medicine in terms of paradigm, we are going to the congresses in medicine to share this approach and the results in terms of health care, in terms of benefits, in terms of what we can do independently of the common medicine. And then it is very interesting, especially in psychiatry congress that I am visiting during the 1 decade and a half, visiting some countries. And today we have psychiatry congress, the high level of medical psychiatry association, the top of the more important group that put all the research in psychiatry together. When I try to share the experience to show to my colleagues, for example, 2019, some month before the pandemic, I visit Lisbon, Portugal, the World Congress of Psychiatry. And I share with 6,000 of colleagues in the big area of mental health. And I try to share with them this kind of seed. This is one seed of light to contribute to the general medicine, but especially in psychiatry. And then they are open to our different kind of contribution. And I could tell with them about Allan Kardec, mediumship, spirituality, spiritual approach of medical and psychiatry diseases, the action of spirits in the spiritual realm that are suffering in that environment, how to deal with them, how to care with them, understanding that not only we are caring of one specific patient, but we are doing some kind of medicine related to benefit the spirits, the discarnated one. Do you understand the importance? We are doing the same medicine, and we are helping them in the spiritual side of life. And they are open the space in this scientific area, in the medical specialty psychiatry, to hear different aspects in terms of this new kind of bridging in terms of spirituality and medicine. And another last observation, not only in psychiatry, but for example, the World Psychiatry Association, they, in December 2019, after Lisbon, I visit Jerusalem because this association, they create a different congress, spirituality and psychiatry. I stay during 3 days with colleagues from many different countries around the world interested in this frontier specifically, from different cultures and different countries. And I come from Brazil to share with them this Spiritist approach. And they offer to me the space to present some general spiritual approach of medical psychiatry disease in a poster. And they offer to me 30 minutes to talk about spiritual approach of autism, because this is a very important challenge in medicine, in psychiatry. And because many different patients here, not only in Rio, because of Facebook, Messenger, WhatsApp, our group, receive many cases trying to obtain this help with this approach. And because of the nice results, we are dealing with a very growing number of patients week by week. Do you understand? I would like to tell you that would you like to have more time to share with you many different ideas about this frontier, but only this is a seed for this night. And I would like to stay here with you. If you have some questions, I will be very happy to talk about this.
Oh, Dr. Sergio, thank you so much for this great talk. Thank you so much for your explanation and reflection on this topic. It was really, really good, and feel invited to come back many, many, many times more. We would be very happy to have you here. Okay, and
Thank you.
we do have some comments and questions. And the first comment is the Publius comment. He's saying, according to the statistics, Jesus Christ is coming to the science side. So scientists are discovering Jesus as a soul doctor. What can you say about it?
Yeah, Publio, thank you for your question. We have about Jesus 200 of papers related to Jesus Christ and medicine, obviously, because this is one site related exclusively of medicine. But we have many different kinds of papers. For example, in terms of Jesus Christ in this site and medicine, we have, for example, people from different countries trying to do some kind of research about what happened during the crucifixion. Why Jesus Christ suffered in terms of lungs and pulmonary insufficiency or hypovolemic shock. And this is not related with the more important ideas that we would like to see from our colleagues, Christians or not. But we have this opening to this idea of the Jesus Christ as the doctor by excellence in terms of all this hospital when or where we are all together here trying to become better in terms of spiritual enlightenment, to not suffer in the future so much as we are suffering now. But this is the future. But now we have many different advancements in terms of spirituality. It is very nice to understand, Marceli, and my colleagues here, that today I can do a prayer in the bedside with my patient in the clinic, in the emergency, or in the intensive care unit, with the patient in the coma because the use of some kind of drug, or because neurologic problem, because when we have a trauma, we have a post-operative neurosurgery, or we have some kind of stroke. So the family of the patients, they are being informed of this kind of approach, the value of the intercessory prayer. For example, Marcel, I have colleagues in cardiology, in cardiovascular surgery. For example, here in Rio de Janeiro, this is a colleague that before beginning the surgery, he invites all the colleagues
to pray
in the environment of the surgical room to pray when the patient are awake before the beginning of the anesthesia to begin the surgery.
Yeah, that's amazing.
And this is very interesting because this colleague, he is one of the best cardiovascular surgeons in Rio. He's not a spiritist, but he invites all the people close their eyes, and he did and does in all the surgeries a prayer to God, to the exit, to the success of the surgical procedure. And when I am together, because I am the cardiologist of that patient, I stay in prayer with all of them in the same time. This is a very beautiful progress in humanity. For example, forgiveness in medicine, gratitude change my brain, change the brain of my patients.
And the vibration too, right?
Yeah, and because of the liberation of neurohormones related to good feelings and love, and all these hormones, they will, because of circulation from the brain to all of the cells of the tissues and organs of that patient.
Wow, that's amazing.
We are changing.
Yeah, we have one more question, some other comments. And Paula is asking, how can the teachings of Spiritism help the practice of medicine? And I
Well,
think you have told.
yeah,
You just
yeah. I think we need to program one seminar, 2 hours, 3 hours, one weekend.
yeah.
But this is very important too, because the people, especially in Brazil,
Mm-hmm.
the people knows about Spiritism
Mm-hmm.
because of not only Allan Kardec, but because of Francisco Cândido Xavier,
Mm-hmm.
Chico Xavier,
Yes.
and they books, because we have 500 of titles, very, very interesting to us
Mm-hmm.
to understand the reality, including this reality, the spiritual understanding of the life, not only the life that we can see with our eyes, but all the different aspects of life, including the spiritual life in the other side, and the relationship of everything related of a nice life uh, in terms of a best future in terms of humankind.
Yeah.
So, I would like to finish maybe remember with you that, for example, in the best uh, universities in the United States of America,
Mm-hmm.
for example, in Europe and in Brazil, in the faculties of medicine, we have the discipline spirituality and medicine. For
Oh.
example, in 1998, I visited Harvard Medical School in Boston to share with my colleagues a course with this title, Spirituality and Medicine, but without Spiritism,
Mm-hmm.
because that colleagues, they don't know about Allan Kardec
Yeah, I get it.
and these books.
Mm-hmm.
But here, uh, frequently, I am invited, and other colleagues too, to talk about this as speakers relating medicine, spiritism, spirituality, and different other things. Mediumship.
Mm-hmm. Wow, thank you so much. And we have one more just comments. Yeah, Camila Clarissa said, thank you so much for sharing your experience and knowledge with us. Please come back for more talks. And we have another comment from Camila. Yeah, I would stay here all night to listen to you. Thank you so
Thank
much for
you.
sharing this piece of information with us. So helpful.
Thank you, Camila. Thank you,
Clarissa.
everyone.
Yeah.
It's a pleasure to me to talk about those aspects of life
Mhm.
and dreaming with you in terms of the future.
Yeah, thank
Thank
you
you so
so
much.
much. Yeah, thank you. For yeah, and Anna said, "What a joy to learn with you, Dr.
Oh,
Jason." I miss you, my friend. Yeah, she miss you.
yeah. Thank you, Anna. My pleasure. I was talking about that visit in that university with Anna and Maria Mesquita,
Mhm.
talking about this frontier too. Uh, do remember the name of the city? I talked with you before the beginning of this lecture. Uh, I love all of you. Thank you so much.
Oh,
And as we are now in other situation in terms of medicine and epidemiology, in terms of COVID, we need to program one visit to Boston and to Canada to
Yeah,
talk.
please come to Canada.
Yeah, yeah, we need to reassume this conferences and study groups,
We
I
would be
suppose.
very happy to have you here in person. But please come back many other times
Thank
here
you.
for our lecture. Okay, thank you so
Thank
much.
you, Marcel, so much. Thank you.
Bye. Have a good night. Okay, so thank you for your participation in the chat. And now we will move for the spiritual treatment. So passes is the transfusion of spiritual energy with the goal of assisting with our physical, emotional, and mental balance. Passes help us to restore a state of harmony and peace by replacing negative energy with health positive energy. In order to receive the best benefits from passes, please follow the audio instructions or remain in prayer. You may close your eyes to help you with mentalization. And during the pass, the water you set aside will also absorb the spiritual energy that your family and you can benefit from. We will now make a prayer in preparation for the pass, which will be our closing prayer as well. Okay. Lord Jesus, once again, we want to thank you for all the things you and all the good spirits have done for us. We thank you for this great talk we had this night, and we ask you to bless Dr. Thyssen and his family. We ask your protection during this treatment, and may all of us may we can be better after this treatment. We ask your blessing for this week and our sleep. Please help us, our family, our friends, and all the humanity, teaching and inspiring us to think and act with love and charity. Please stay with us today and always.
Let us now prepare ourselves for the moment of the passes and the magnetization of water. Let's now calm our hearts, breathing in and out. Pay attention to your body. Focus on your breath and let yourself be carried by this energy. Let your thoughts pass by without judging them. Let them flow. Allow this light to be the beacon that guides you, and allow these words to penetrate your energy. Make each word an anchor of gratitude, faith, and trust. With the purpose of healing, which takes away my faith, healing every feeling of separation, of pain, let it all dissolve in this moment, leaving only love, gratitude, and trust. We ask God for the presence of our guardian angel and the friendly spirits who welcome us into this enlightened environment of our Spiritist Center. We open our plexus of love and forgiveness by mentalizing a light surrounding our hearts. Find a quiet and comfortable place to begin the mentalization process. Remove all worries from your thoughts. We ask that during the pass you breathe slowly and deeply. Let your body relax and surrender yourself to a deep meditation. Calmly imagine divine energies in soft and colorful light surrounding you in an environment of peace and spiritual warmth. Entrusting God with your most intimate desires, raise your thoughts to Jesus and the emissaries of the spiritual environment. The past begins with the cleansing of your soul. Imagine a waterfall of crystal clear water pouring over us, removing all the feelings that keep you away from faith and trust. Feel the energy of this water bathing you and deeply breathe in, feeling peace and harmony. Allow this water to wash away all the impurities and spiritual larvae, washing away all the sorrows and resentments, any feelings of hatred and revenge that hold us back and cause us harm, not only from this life, but past ones as well. Now visualize spiritual doctors around you, applying magnetic cleansing passes, sanitizing your spiritual body of all sadness and negative energy. Mentalize these negative thoughts and feelings being washed away, evaporating from your soul, like water evaporating into thin air, and being carried far away from your mind. Surround yourself with the faith that bathes your being, bringing clarity and lucidity, rebalancing every cell in your body. May the water envelop all pain and bring the clarity of opportunity that chooses peace. The answer arises in our hearts, freeing us from all evil and freeing all whom we have caused evil into and who have caused us evil. Washing away all the connections that bind us. Even though we may not understand, we are freeing ourselves from all that causes us harm. Feel this cleansing penetrate your soul and release. Now that we are spiritually cleansed, imagine yourself surrounded by the light of love from the hands of Jesus. At this moment, sing words of faith and gratitude, being faithful to the light that exists in me, planted by the zealous Father. Imagine the sunlight that surrounds and enraptures, freeing us from the chains of everything that holds us down, strengthening your faith. Allow yourself to trust in this light, surrender to it, involved in pleasant feelings and feeling relieved to receive the strengthening lights. Mentalize your spiritual mentors now applying divine light for the strengthening of your mind and your emotions, leaving you feeling emotionally revitalized. Let us now mentalize the magnetization of this water. May we mentalize all the friendly spirits, magnetizing this water and filling it with everything that our bodies, minds, and soul need, so that it may be of help to us when we drink it after the Pass. Thank you, God.
I would like to thank you everyone for joining us tonight. And we will be back next Tuesday here on Spiritism Canada and Continental Concafres America at 8:30 p.m. East, and next Wednesday on Kardec Radio at 8 p.m. Have a good night. Bye. See you Tuesday.
Sometimes it's not so easy. Sometimes it's not so close. Sometimes we build our dreams, but then we see them decompose. When you feel down the dumps, feeling sad and blue, Give life a chance, my friend, the sun will shine again on you. Believe you can come through. The rainy days are true. Have little faith in you. Maybe tomorrow you can dream all your dreams again. Though some sorrow remains, it doesn't mean the end. Believe you can come through. The rainy days are true. Sometimes okay to feel blue. Have little faith in you. Dream all your dreams again. Though some sorrow remains, your dreams can get you through. Have little faith